continue to have our smoking cessation programs. Will continue to be one of our #1 things we do in southern Indiana and central Indiana, because it is the #1 cause of premature birth. #1. #2 is maternal education. Apparently, when you become pregnant, there's not always a handbook nearby you can read to figure out what you need to do to deliver a baby in a healthy manner and to make sure that premature birth doesn't happen. So that will continue to be a priority for us, and that is also, again, about where 25% of what we do goes. The last one is the biggest, and that is research. Now, it takes us about 10 years to get another breakthrough. That's kind of how the cycle goes. We have 5 research centers all over the country. They work with each other like a professional learning community. The biggest news you're going to hear in winter, although we are allowed to introduce that information to you now, is that the breakthrough we have is a blood test that's coming. And this blood test is going to allow us, with a 75 to 80% assuredness, to tell us, using blood markers, when a mother is going to have a premature birth. Knowing this information is going to massively change how we do things. Now, it's going to take us a while to get this implemented into every hospital in the United States and overseas. As you know, we also are in Europe as well. So it's going to take time, but with your support, we're going to continue to just try to kick it up a notch and see if we can't get this whole premature birth thing down here in Indiana. We're also going to be working on, of course, lowering maternal mortality. It's not been great in Indiana as well.
As you can see on the website, over 600 babies in Indiana died before their first birthday last year. That puts us at the 7th or 8th in the nation for infant mortality, which is parallel to some third world countries. So that's a major problem, something that we're really hoping to tackle and help with. So your gifts are helping Riley hire up to 12 maternal fetal medicine specialists to address the shortage of care for mothers with high-risk pregnancies. They saw over 12,000 visits last year alone. So that is something we're really working on, and as of right now, you cannot deliver babies at Riley Hospital for Children. We are fundraising with the Be the Hope Now campaign, and hopefully by the year of 2020, our new mother-baby hospital will be opened, and we will be delivering babies, and happy to tackle that issue and doing whatever we can. So all the money for all these organizations is going to be put to good use and to help tackle this huge issue in our state. So thank you so much.
What we plan on doing with the money, again, as you said, our team's in its infancy, but we feel it would be best used at this point in our community fair that we're going to be having September with CareSource. And it does focus specifically on low-income women, and what we want to target specifically is screenings, like prenatal screenings, and then also connecting those folks with resources to try to make sure they get early prenatal care, and then are connected with things like Nurse Family Partnership Program and WIC. And then also are getting in to see those the doctors if they need to, and then get connected with the pediatricians. We're also working on a resource guide, a comprehensive guide for providers, so that they know what is available out in the community, because this is a great community for people to have a baby. So.